Hello, my name is Theola Cooper, and I'd like to welcome you to this edition of For the Love of You. For the Love of You main focus is to help you to become a better, healthier you. And today as our guest, we're pleased to have Dr. Anthony Montague Sr. Dr. Montague is an avid proponent of eradicating the disparities in healthcare that currently exist today. And Dr. Montague believes that this can be accomplished by focusing on educating both our patients and our providers in training. Dr. Montague graduated summa cum laude from Xavier University in New Orleans, Louisiana, and then completed his medical degree at the Uniformed Services University of the Health Sciences with honors in family medicine. So without further ado, I'd like to introduce Dr. Montague.
Good morning.
Good morning. How are you today?
I'm doing well. Thank you for having me.
We're glad to have you here. For the Love of You actually started as an initiative with the American Heart Association's Together to End Stroke, and I'm a Together to End Stroke ambassador. Mm-hmm. And we've covered things on how to exercise to make you more healthy, how being a healthcare provider for someone who has suffered stroke, what the effects of that is on the family, and how we can help, particularly our male population, get more engaged in that conversation in regards for them to become healthier as well. So we welcome you today.
Thank you.
So if you give me a little brief overview about what you do and some of the things that you've done in North Omaha.
I first became acquainted with North Omaha by working with Charles Drew Health Center Fathers for a Lifetime initiative. This is a program that takes all men, but especially high-risk men, and teaches them how to be more active and involved in their children's lives. I had been a participant in that program for about 10 years before I actually started working at the Charles Drew Community Health Center Clinic, located off of 30th and Lake. And I actually served as the medical director for the clinic from 2015 through earlier this year. By being involved in both community education as well as providing direct patient care to the North Omaha community, I think that I became very well acquainted with the needs of North Omaha and some of the unique challenges that we face.
Okay. And you mentioned some of the challenges that we face. What are some of those?
I would definitely say that the biggest challenge that we face in North Omaha is the lack of access to medical care and also lack of access to fresh fruit and vegetables. Many people may not know, but North Omaha is considered a food desert. Which essentially a simplified definition would be limited access to high quality foods, including fresh fruits and vegetables, within walking distance of someone's house. So North Omaha is actually classified as a food desert. There's also a significant lack of sidewalks for people to be able to just get the normal cardiovascular exercise that we'd like them to get in any given day. What surprises many people outside of North Omaha is the lack of health literacy, meaning the knowledge of what to do to lead a healthier lifestyle. And if parents don't know how to live a healthy lifestyle, then it makes it even more challenging for them to teach their children how to live a healthier lifestyle. And we get into a vicious cycle that leads to poor and poor health outcomes in our communities.
I definitely agree with that. And you mentioned Fathers for a Lifetime. What were some of the things that you implemented with Fathers for a Lifetime?
Well, let me say that I not only taught Fathers for a Lifetime, but I am a graduate of Fathers for a Lifetime program myself.
Okay.
Going through the program firsthand really opened my eyes to the lack of knowledge of resources available to fathers. And I was very interested in seeing what I could do to help the program along. So after becoming a graduate, I became not just a spokesperson, but a regular contributor to the program as well. And some of the things that the Fathers for a Lifetime program teaches is it teaches better communication style. It makes sure that fathers understand that conflict takes two people. And no matter how contentious the relationship may be between you and the mother of your children, whether that's your wife or a significant other or a relationship that's now ended, you really can't have an argument unless both people choose to participate. So It can be difficult, but we actually take 2 classes to teach that you can walk away and prevent an argument from occurring. And that when you decrease conflict, you increase the well-being of the child. Because when there is conflict between a mother and father, it typically affects both academic and their physical health as well.
Yes.
We teach fathers about the judicial system. We make sure that they understand that they do have guaranteed access to their children, that they have access to their children's school records, and that they have a right to participate in the lives of their children, and that no one can tell them, other than a court, that no one can tell them that they can't be present. And then I also participate with teaching fathers how to financially manage their money and also how to manage their health so that they can be there for their kids.
Yes, and that is very, very important to hear you say that, because I think a lot of times as adults, we forget that our actions do affect our kids, you know. And I really like how you talked about, you know, you can choose to walk away. You don't necessarily, you know, have to keep that unnecessary negative communication going on, you know, with the person who you're no longer with. Because even with me working for the police department, you know, we usually try to tell people walk away. It's not necessary for you to put hands on anyone. And the effects and the repercussions that they have, you know, on your children seeing that type of behavior. And sometimes children will mimic that behavior later on in life. And that can be an unhealthy cycle as well.
I really like a program that the Douglas County Courthouse requires every parent to attend when they're going through any type of custody dispute. And I believe it's called What About the Children?
Okay.
And we use some of those same statistics in the Fathers for a Lifetime program, some of those same studies. But both the courthouse and Fathers for a Lifetime rely upon data that specifically shows that children do much better when they're in a conflict-free zone or less of a conflict. Studies also show that the chances of a child living a healthier life go up significantly when the father lives a healthier lifestyle. Yes. So if the father exercises and displays healthy behavior to their children, whether male or female, then that child is actually more likely as an adult to continue with exercising and living a healthy lifestyle, including their eating choices. And that correlation goes up even higher between a father and his daughter than it is between a father and his son.
Yes. Okay. I see here too that your philosophy applies not only in the U.S., but you also did some travel, some missionary work. Would you like to explain that?
Yes.
Talk a little about your missionary work that you've done.
It's been a wonderful set of opportunities that I've had. I served in the United States Air Force for approximately 10 years. And my first chance to do what most people call a missionary trip, I can't call it that in the military, so we call it a public relations mission.
Okay, gotcha.
Was to travel to Jamaica.
Okay.
And many people think of Jamaica just as a tourist industry.
Right.
But we were in mountainous regions. We were in some very poor regions, far away from the tourist areas. And it was the first time in my life ever to see people that did not have access to care, and to see what some simple things in the United States, simple conditions, could turn to if they didn't have treatment. I saw someone that had a large goiter, which is a large mass that grows off of the thyroid if it's not treated properly. We would never see anything like that in the United States.
Right.
We saw someone that was going into heart failure because they had anemia and they didn't have access to iron tablets, which we can purchase over the counter in even the poorest of neighborhoods here in the United States. So that actually gave me my first real look at what happens when we don't take care of people, when they don't have access to regular preventative health care. And since then, I've had the chance to go to other places. I've been back to Jamaica a few times. I had a chance to provide health care in Kenya. I've also had the chance to provide care in the Dominican Republic. Again, tourist area, but when you're in places like Constanzo and Arroyo-Arriba, it's a lot different.
It's definitely a lot different. There is no trickle-down effect from the tourist industry. I remember thinking the same thing many years ago when I had the opportunity to visit Jamaica for pleasure, as most people do. But the shuttle took us through, the way the shuttle route was, I did see shanties, and I was concerned, if this is really a huge tourist industry, why are people still living like this in this day and age? So it's just something for us to think about as well when we go visit different countries. You know, what exactly is going on? Where are some of the hidden areas that you don't see?
And it's not always even hidden areas. Sometimes we get so comfortable in our own lifestyles that we become accustomed to what we live and what we experience every day. So I encourage everyone to make sure that they're doing something to come across people that are not as well off as them, so that they can be reminded not only of what their blessings are, but so that hopefully it'll create in them a desire to help others, whether that's working at a homeless shelter, volunteering at a food pantry, volunteering to pass out socks during the wintertime to the homeless. But when you intentionally make sure that you see other people, it will open your eyes and you'll realize that there are many more people that are less privileged around you that you just weren't noticing.
And very less fortunate than you are, even right here in Omaha. You know, a lot of people don't understand some of the things that we see daily in regards to healthcare, in regards to just having someone meet that basic need of being fed or of shelter. So to quit comparing ourselves to, well, this person has this. Well, you have running water, you have shelter, you have food, you have access to health care. And I really like when you talk about how people don't really know how to be advocates for their health, you know, what they need to expound on in regards to, for example, when a previous conversation when we just had as the lady not knowing that diabetes was not a death sentence, but nobody had ever taken the time to talk to her about how just for making lifestyle changes, it didn't have to be a death sentence, even though generational, she thought that it was.
Let me give you two more examples of conversations that I had with patients in North Omaha, and that directly correlate between access to resources and direct effects upon health. I had a patient that was diabetic and initially had his blood sugars under control, but suddenly started having wild fluctuations in his sugars, actually became hospitalized, nearly went into a very dangerous condition called diabetic ketoacidosis. Most people know it as DKA for short. And it turns out that it took him several months before he was able to be comfortable letting me know that even though he wasn't homeless, he had food insecurity, and so he was getting his foods at a homeless shelter. And therefore, he was at the mercy of whatever was available at the food shelter. And because there wasn't high quality foods, because it was usually processed meats, processed foods, but this is all that he had access to. He didn't have money to go out and buy fresh fruits and vegetables. He didn't have access to those things. It significantly affected his blood sugars. And it wasn't until he felt comfortable sharing with me and that I don't have the resources, I don't have access, I can only eat what the shelter provides for me, and that we're able to get the nutritionist to work with him and be able to get him access to higher quality meals. And immediately we saw a return to normal in his blood sugars, which decreased his risk for heart disease, heart attack, and stroke. I had another patient who also was under great control previously, and then suddenly her A1C, her blood sugar just started going up and up and up to the point where we actually had to hospitalize her. And finally she shared with the dietitian that she could no longer afford her insulin, so she could only take it every other day to stretch it out. She could only afford to buy her medication once every 6 months instead of once every 3 months. And so we were able to get her access through a drug manufacturer donation to have her insulin every day, and then instantly her numbers return back to normal. So we have patients that don't have access to food, don't have access to regular exercise, and some patients that can't even afford their medications. And if we're not aware of that, and if we don't have resources for those patients, then no matter what we do, it's not going to make a significant difference.
Exactly, exactly. And we need to be able to, patients not to feel embarrassed by that, because you know, even in today's economy, one day you could have full health care to pay for your medication, and another day you may not. You know, we're only living check to check. And I think the pridefulness, and I understand that, that people just need to be able to ask, you know, this is something that is really, that I really need to maintain my life. So what can I get? You know, what programs and things are out there for me so that I don't have to miss my doses of medication that are, you know, for my life. And once again, like you said, if people don't know, they don't ask. And we need to let more people know that they have the right to ask, you know, look, I can't afford this. What are some of the alternatives that I can use? This is something that I really need. So what can I do? And I applaud your efforts for having those discussions with patients, because, like I said, a lot of them are just too scared. And especially in the African American community, I'm finding that our elders won't really ask questions. It'll take somebody, maybe a generation younger to say, no, this is not how this is supposed to go. Why aren't you getting better? Why aren't you doing this? Why aren't you, finishing your meds or taking your meds daily? You can't skip your medications daily. Just different things like that. So the full family really has to be involved in this.
You hit on something that I think, multiple things that are extremely important, but something that I'd like to reiterate is that we have to get past the fear of being embarrassed by stating that you have a need. And I want to share a personal story to make sure that everyone understands that anyone can fall into that situation. I shared with you before the interview started that I'm originally from New Orleans, Louisiana. Hurricane Katrina hit in August of 2005. Unfortunately, at that time period, I had just started going through a divorce in my first marriage and was going through a very costly legal battle. When Hurricane Katrina hit, my family was adversely affected and lost contact with my mother for several days. So I wound up having to fly her in. I was already maintaining 2 households going through a divorce. And it got to the point where I needed help just paying bills. I was still in the military at the time, and you don't get rich being in the military.
No, contrary to popular belief.
even as a physician. So for a 3-month time period, things were very hard on me financially, and it was difficult for me to ask for help because I felt that I should not have to ask for help. I'm a physician. But the combination of the strain of a divorce, maintaining 2 households and helping my family to recover after Hurricane Katrina was just too much for me to handle on my own. And I had to rely on others. So everyone has to understand that if the right set of circumstances hit, you're going to need help. And that sooner or later, all of us are going to experience that. And it's not a sign of weakness to ask for help. The sign of strength is to acknowledge where you need help and to not be afraid to ask for that. So if you can't afford your medications, if you're having difficulty with access to fresh fruits and vegetables, if you just don't know, don't be afraid to ask someone for help. And I can tell you that the community health centers, Charles Drew Community Health Center, which I specifically worked at, would be more than happy to help you find those answers. Even if we don't have the direct answers ourselves, we'll find a way to get you what you need.
Exactly, and like I said, I can't reiterate enough. It's even in a professional capacity as myself, it would be hard for me to ask for help, even though I know I would definitely need it. And so that things can happen, all of us. It's just daily life that can happen to us, and that I really believe that it's true. A lot of us are only one paycheck away from being the person that we see on the streets or being the person that is without shelter, just different things like that. And we always have to make sure that we are our brothers and our sisters' keeper and be willing to, like I said, to extend, really to let you know that this is what we can do. This is how we can help. Okay, I really like that as well. You have a motto, we must be who we say we are. Would you like to expand on that?
Again, in working at Charles Drew, we began to realize that there's an old motto that says, people don't care how much you know until they know how much you care. And in dealing with a group that does not know a lot about good healthcare habits, it didn't matter that we knew more than they did and that we wanted to tell them. What mattered most to the community was that, are you here to make yourself feel better by saying that you gave back? Or are you here because you genuinely care and you want me to live a healthier lifestyle? So is this just something to make you feel good about yourself, or are you really invested in making a difference? And as I was thinking about this, one night it just came to me. Actually, I shouldn't say one night. While I was talking to the medical department one day, it just came out. We must be who we say we are. We say at Charles Drew that we want to be the face of healthcare in North Omaha, that we want North Omaha to have the same standard of health, if not better, than the general population in the state. If we want those things, are we living that type of lifestyle, first of all? Are we living a healthy lifestyle? Are we exercising? Are we eating healthy? And when we see a patient, are we treating that patient the same way we would want someone to treat our family member or even ourselves? So when I see someone that's my mother's age, I'm concerned because is that person getting the same type of treatment that my mother would get? Is that person getting, when I see a child, is that person getting the same type of treatment that my child would get? Are we treating people the same way that we want to be treated ourselves? And once we do that, it'll be much easier for patients to open up to us and tell us what their needs are so that we can stop beating around the bush and get straight to the action.
I really agree with that. I concur with that because it's so basic that I don't understand why more people just don't follow that. You know, if you don't want to be talked down to or always, I say browbeat it, just because if you're lacking knowledge about different things, then you know, why would you think somebody else would like to be treated that way too? And I will say too, with Charles Drew, I know they are part of when they have the fresh fruits and vegetables, the community gardens. There's different places that are really starting to adhere to that in North Omaha too. And we just have to continue to get the word out. You know, there's several locations. I know about one on 24th Street that has community garden as well. And like I said, Charles Drew at 30th, they have their farmers market along with the Exarban Village Market or the farmers market down in the old market as well. Clare Memorial Methodist, and that's another instance. And I know Nebraska Children's Home Society also has fresh fruits and vegetables, and people can learn how to tend their garden as well. So with that being said, oh my God, you have really provided us with a lot of information today. Is there a number or somewhere that people could get in contact with you or that you'd like to share?
I think the most important number to share would be the number for Charles Drew Community Health Center.
Okay.
And to let anyone know that Charles Drew is dedicated to seeing patients regardless of your ability to pay. So if you have health insurance, almost every health insurance is accepted there. If you don't have health insurance, then they'll work with you to formulate a plan to be able to pay for the care. But what's most important to the community health center movement as a whole is that we provide good, high quality access to health care. And the main number there is 402 451-3553.
Well, Dr. Montague, thank you so much for agreeing to be a part of For the Love of You. And you have really shared a wealth of knowledge that a lot of people didn't know that's out there for us to take advantage of. So this is our edition of For the Love of You. We like to tell you to take care, keep moving, and God bless.